Good afternoon, everybody. We're going to get started in just a minute as we allow for more attendees to join the call. Good afternoon, everyone. I'm Andrew Sorensen, spokesperson here at CU Boulder. I'll be moderating today's call. Some quick housekeeping items before we get started. If you have a question for the experts on today's webinar, please use the Q&A function at the bottom of your screen to submit a question. You can start doing so now. We will do our best to get to all questions. If we do not get to your question, you can reach out to us at colorado.edu/COVID-19. There's a chat function in the bottom right-hand corner. Also, our experts will answer your questions until the questions run out. If by chance we have no more questions prior to the scheduled ending of the webinar, we will end early. And as a reminder, today's call will be recorded. This recording will be added to our COVID-19 website. On today's call, we have Jennifer McDuffie, Associate Vice Chancellor for Health and Wellness. She's also heading up our campus pandemic response office. Laura Arroyo, Director of Housing and Administration in the Division of Student Affairs, and Catherine Eggert, Senior Vice Provost for Academic Planning and Assessment. We also have with us Mark Hyatt, Police Commander with CU Boulder Police. I'll now turn it over to Jennifer McDuffie, who's going to get us started today with some opening remarks.
Hi, everyone. Thank you so much for joining us. We are so excited to welcome our students back to campus this week. Move-in for our residence hall students started on Sunday. And next week, we begin the in-person and hybrid courses. I wanted to share a few updates with you, as well as some positive changes as we welcome back our students, as well as all of you to the community. Last Saturday, Boulder County and a number of counties across Colorado moved to yellow level on the dial, which means there's still a level of concern and precautions that need to be taken, but it is a step in the right direction. This Colorado state dial will continue to be updated weekly and will be based on a 1-week cumulative incident and average positivity rate. This means that we will see more frequent changes to the dial, which had previously focused on data for 14 days or 2 weeks. To ensure that our campus community knows what each phase of the dial the Boulder County is in, we have added a banner across many pages of our campus website to make it easier to know where we are in that day. We also will have campus operations and other signage around campus, and you can find out more at colorado.edu/protect-our-herd. Our dashboard shows that as of February 8th, so yesterday, that 1,682 monitoring tests were completed. Almost 200, 194 to be exact, PCR diagnostic tests have also been completed, and 10 positives were identified. Through our dashboard numbers, we're seeing increased rates of monitoring testing because our students are returning to the residence halls. And as a requirement, each student is asked to test prior to checking in. Our own campus residents are also required to test weekly, just like last semester, and we continue to thank them each week for taking this step. We're also expecting all of our faculty, staff, and students who come to campus for work, classes, research, or other reasons to participate in monitoring on a weekly basis. I came yesterday and within 2 minutes was able to take my buff pass, complete my monitoring test, and be on my way to the office. CU Boulder students, staff, and faculty are also encouraged to do the right thing and protect our herd. And in doing so, we have incentives and other giveaways. Last week, that included Apple pencils, gift cards to Whole Foods, Spotify, and of course, our CU bookstore. We always love giving out buff gear. Each week, we will have a various updates and other offerings available to our community. We hope that you continue to look at those offerings via email, but also stop in to the University Memorial Center, the Rec Center, or other reception desk at Norland, Gimmel Engineering, or the business libraries to pick up free and reusable face coverings. Many people are asking questions about whether they should or should not wear 2 masks to combat the spread of the new variants. Health officials say the most important thing is that the fit on your face covers your nose and mouth. Make sure there are no gaps, and make sure that if it's a cloth mask, 2 or 3 layers are always recommended. To our students, to our families in the audience today, we are so excited to have you back on campus. We appreciate all that you're doing. And walking around yesterday, we saw physical distancing, masking, and just a lot of enthusiasm for being back in school. We know that for many of us, it's so important that we're back in person. With the positive changes in the dial, we're also working on how to engage our community. We'll have more in-person events and small gatherings as long as it's safe to do so. We have over 500 events planned this semester, both in person and virtual, so that students can find something to do that fits their interests. If you haven't visited, please do visit the Student Events tab on the Student Affairs website. There's so much opportunity, from bingo to grab and go activities to really looking at food insecurity and the buff pantry. We also have talked to a lot of students who are struggling, and it's very challenging to come back to campus in the midst of a pandemic. And we want our students to know that we're here for you. Whether it's Let's Talk, which is a free service where you drop in and talk without any records being shared, or it's coming into any of our offices and saying hello and asking what services or opportunities are available. We want you to know that we're here for you. CU Boulder has a number of resources and opportunities for our students. We want to help you with connections, belonging, and engagement. We are very excited to have you here, and we want to have a very safe and healthy semester. And with that, I'm going to turn it over to my colleague, Laura Arroyo, who's going to speak more about housing and the things happening in her area.
Thank you, Jennifer. In conjunction with our planning for the spring 2021 semester, we're also making intentional plans for the upcoming fall and the upcoming entire academic year. While we all hope for a more traditional experience in the fall, it is important that we plan to support the health and safety of our entire campus community next academic year. For us in housing, that includes holding adequate space for isolation for our on-campus housing residents, working to support incoming and returning students, and considering a seamless integration between students who live on and live off campus. This includes first-year students, the increased deferrals we've received due to this year's impacts of COVID-19, our transfer students, and our current CU students. We have heard from many families and students. The students were missing the more traditional first-year experience, which has certainly caused an increased interest in our on-campus housing. We are working to accommodate as many students as possible, while also recognizing that the majority of our second and our third-year students historically do live off campus within the greater Boulder community. For our upcoming academic year, we will be utilizing our on-campus apartment communities, particularly Bear Creek, to support current students who wish to return, our rising second years, as well as expected deferrals and our transfer students. This requires much thoughtful planning to ensure a robust experience that supports students by each of their class years. Current Bear Creek residents are being given priority to return to Bear Creek, an important aspect of this plan, which supports potential for housing vulnerability as well as affordable housing for student needs. For those students who do move off campus, on-campus housing will be working closely with off-campus housing and neighborhood relations to create as seamless of a transition as possible, one which supports students learning the expectations and the safety needs to live within the greater Boulder community. There's still much housing available off campus, and we are working hand in hand, student by student. We encourage students to reach out to our off-campus housing team should they need support navigating the Ralphie's list, or to attend the upcoming housing fair for more information on housing availability. Should anyone have questions regarding their housing experience, please know that we truly welcome your feedback. CU students matter to us no matter where they live, and your feedback is important and it's deeply valued. And now I'd like to turn it back over to Catherine Eggert.
Thanks, Laura, and thanks everyone for being here. I'm here to talk a little bit about academics before we move to questions. As planned, we're going to be returning on February 15th, next Monday, to our blend of in-person, hybrid in-person, and remote instruction modes. What that means is that starting on Monday, the 15th, every class will be taught in the instruction mode that was listed when students registered for classes. If you signed up for an in-person class, for example, that course will be taught in person. If you signed up for a remote class, that class will stay remote. Hybrid classes will be taught according to the attendance pattern and instruction mode that was already set up in the class syllabus. So if you're enrolled in a hybrid class and you're unsure about when to attend class in person, you should contact your instructor right away. We've scheduled 2 wellness days this semester. The first is coming up next week on Wednesday, February 17th, and the second will be in March 25th. No classes will be held on those wellness days, and instructors also know that they're not to schedule any review sessions, any makeup classes, anything like that. Instructors have also been advised not to have any major assignments or exams the following day, February 18th or March 26th, so that our students can truly take a day off to rest and recharge. It's important to note that the data compiled by our faculty experts shows that in the fall semester, our preparation of classrooms, laboratories, and learning spaces was successful. We did not have a single known case of transmission of the virus in our labs or our classrooms. We also know that all of the health and safety protocols that we applied on campus in the fall are equally effective at preventing the spread of the new variants of the COVID-19 virus. There is no increased risk when our COVID prevention protocols are followed. And now I'd like to turn it back to Andrew to start our Q&A.
Thank you very much to Jennifer, Laura, and Catherine. We want to give all of you the maximum amount of time for your questions. If you'd like to ask a question, please use that Q&A function at the bottom of your screen. We are prioritizing questions from students and family members. And we'll start with this one for Jennifer. Is the university working with the state to change the vaccine status of our faculty?
Andrew, thank you for that question. And I believe that we noted last week that it was one of the things that we were really focused on as information came available from the state regarding the definition of educators as K through 12 and early childhood educators. The University of Colorado Boulder, as well as the system, is committed to advocating on behalf of our faculty and staff, and have been working with the state on the definition to expand that to higher education, faculty, and staff. We're very grateful for those opportunities, but at this time, we have not received any new information about when or where we will be in the phased approach.
All right, and another one for Jennifer. This one looks like a bit of a two-parter. What are the expectations regarding testing for students who have recently had and recovered from COVID, given that they're likely to test positive for 3 months after infection? This person says their son lives off campus and has an in-person class this semester. He contracted COVID while at home over winter break and completed quarantine at home before returning to Boulder. Is he required to participate in weekly monitoring tests? And if so, what provisions will be made for the fact that he's likely to test positive but not be infectious?
Andrew, thank you. I want to make sure I get to both parts of the question. So for the first one, I believe it was around 90 days. So we have a number of our community members who have tested positive. And if it's a student, we encourage them to go into their Buff Pass and to upload the test results in their MyCU Health portal. You can do so by clicking the link in the Buff Pass. The piece to note is anyone who tests positive and provides that letter from a provider that they've tested positive, we would then remove them from the required expectations of testing for the 90-day window, because I believe the point was made that they will probably screen positive should they be tested. And we just want to make sure that we're using our resources effectively. For students and others who may be in that situation, there are a couple of things to note. One is obviously we're willing to work with you. Two is the Buff Pass does allow for uploading and the removal from those testing requirements. And three, should anything change, even within the 90 days around symptoms, we encourage you to go as soon as you can to a provider, to medical services, and get a test just to make sure that you're okay. Reinfection is very rare within the 90 days, but it's not impossible.
All right, thank you so much. A question for Catherine Eggert here. Can you go over again what the expectations are for faculty convening in-person, remote, or with hybrid classes?
Yeah, thanks for that question. So again, students signed up when they registered for a class instruction mode. So starting next week, when students return to campus, that is the instruction mode that the class will be taught in. So if they signed up for an in-person class, that is entirely in person and it was listed that way, that's the instruction mode that the class should be offered in. Same for remote. If it's designated as a remote class, an online class, that's how the class should be offered. And hybrid classes, the faculty member will have designated the attendance pattern for that hybrid class. So students may attend on some days and not others. If you're not clear on what days to attend, contact your instructor. We've also been getting questions from instructors that a student may contact them and ask, they're teaching an in-person class. It's an entirely in-person class, and the student has contacted them and says, can I take this class remotely? I'm in your class. When we come back in person, can I take it remotely? And the answer is that you, as an instructor, you are not obliged to teach that in-person class simultaneously remotely. You've signed up yourself to teach it in person, and that's what the students should expect. So you should feel free to decline that request because students know that they are expected to attend in person if that's the class mode they've signed up for.
All right, thank you so much. Next question for Commander Hyatt. We're hearing about parties on the Hill and other places in neighborhoods with lots of students. What can be done about this?
Well, the important part to this is calling the Boulder Police Department. And if you are seeing house parties and other large gatherings, and giving as much information to them as you can. That enables them to hopefully identify who the students are and to then engage with the university so that they can take enforcement action.
Okay, thank you. Another question for Jennifer. Are there increased risks to campus safety as a result of the new COVID variants?
That's a very challenging question as more variants and more information become available. It's something that we continue to monitor. It's something that we work with our local and state partners on identifying. But I think the important piece is what we do know. We know that the preventative measures of masking or face coverings physical distancing, being in spaces and places shorter than the duration of 15 minutes with others, and really commingling outside of your household is vital for us to stop the spread of the coronaviruses and their variants. I think the other piece to really note, Andrew, as we talk about the variants, is so often we see spreading through asymptomatic people. And so not only following those public health measures, but getting frequent testing is going to be really key to our success, because some people may not know that they have any symptoms and could be spreading the virus.
Great point. Thank you. A question for Laura Arroyo here. What kind of enforcement do you plan to do in residence halls to promote safety?
That's a great question. I really think that this really goes hand in hand with the things that we're doing also with off-campus housing. We have student staff currently that live in our building that are very responsible and supportive of the community. And then we also have residential service officers who work in the evening. Of course, we see more activity in the evenings, so their presence is very helpful to our greater community. Whenever we receive a report or we see an incident that occurs in the residence halls, we then work very closely with student conduct and conflict resolution to make sure that we're supporting students to both hold them accountable, but also to educate them about our expectations as we move forward. And one thing I will note, we do have new students in our community. So there's new students coming into our residence halls for the spring, and it's important that we really work to educate those students as well.
Thank you so much. Another question here for Jennifer. Will the COVID vaccine be mandatory, a mandatory immunization for incoming students in the future?
Andrew, that is a very good question and a really challenging one. We've talked a lot about immunizations and really around the vaccine as more information comes available. I think the important note is right now, or the foreseeable future, there are a couple of key indicators that are going to be really critical for us to even consider it being required. One is all of the vaccines at this point are under the emergency authorization. And so, you know, there's a lot of long-term studies that still need to be conducted. The other is supply. We want to make sure that when we, you know, have those conversations around requiring anything, that it's not a barrier for someone to receiving it. And currently it's not in mass production where everyone who wants it can get it. I think the other questions that we have to really ask ourselves is, what is the state? What is the federal guidance around the vaccines? And so if you were going to say for fall 2021, is it required? I would say there's not enough information to warrant the conversation of requiring. I think that it's something that not only do public health officials, medical providers, as well as government agencies really have to consider in the years coming. But at this point, more to come.
Okay, thank you. Another question for Catherine Eggert. Are faculty and graduate student instructors safe to return to the classroom given the variants of COVID-19 that are emerging along with the slow delivery of a vaccine?
Thanks for that question. I want to reiterate that we had a very successful experience in the fall, thanks to tremendous work from our facilities folks and our campus experts. Because of the mitigation efforts we put into place for the classrooms, we did not have a single incident reported of classroom spread of the virus, or laboratory spread for that matter. So all evidence shows that those same measures that we are doing in our classrooms, which include distancing, mask wearing, and also our increased ventilation protocols, all of those same measures will also prevent spread of any variants of the COVID virus. So I understand that the variants are concerning, especially when it comes to the upcoming efficacy of vaccines. But we are confident that nothing has changed in terms of working in the classroom or working in the laboratory. Follow the procedures, and we are confident that we have mitigated the spread of the virus to the greatest extent possible.
Okay, great. Another question for Laura Arroyo. It would be great to have a storage area or drop-off location for OOS students to place their luggage while they go to the testing center. Are dorm entrances open that could be used for this purpose during move-in this week?
That's a great question. And what we're really asking students to do is go to that testing site first. And that's important because we want to make sure that students are tested and that they can then proceed onto their residence hall and go right to their residence hall rooms, go right into their space. And so right now, we're really asking students to go to that testing, but I will say that we are working very, very hard to make sure that that moves as quickly as possible, and it really doesn't impact students significantly. They can come to campus, they can check in at the testing site, complete their testing, and go right to their residence hall communities. The other thing I will say is it's important for them to keep their luggage with them for their own safety. I would hate for them to drop off luggage somewhere and then return and that luggage not be there when they come back. So we really ask that they keep their belongings with them.
Absolutely. A couple of questions here for Catherine Eggert, two related questions from two different participants today. The first, are you going to allow professors to have a class vote on whether they want to continue doing the class in the format it was intended? The second is, this person's daughter returned to the dorms and was looking forward to 2 in-person classes next week. One professor has said they will not be holding those in-person classes and they will stay remote. The question is, how is that allowed when we keep insisting that the modality will not change from what they signed up for?
Yeah, let me take those questions in reverse order. Because I want to say first, it's really important that we offer our classes in the mode that we advertise them as being. That's part of our campus responsibility. It's part of what we advertise to our public, to our students, that here's how our classes will be offered. So for the student who expected a class in person and has learned that the professor plans to offer it remotely, that really concerns me, quite frankly. And I would ask the parent or the student to email me. You see my name on the screen. It's catherine.eggert@colorado.edu. So we can clear that up, because there must have been some miscommunication along the way with the faculty member. The second question, or really the first question, was about whether a class can vote to change its instruction mode. The answer again is no. That we have offered or we have advertised rather, that we're offering a class in a certain mode. That's what the student has signed up for. And voting always sounds like a good idea, but there can be inadvertent pressures on students to vote in a certain way. Maybe they don't really want the class to be remote, but their fellow classmates say, "Oh, come on, vote that way. We all want it." So I just want to say that the students have been told, and were told when they registered, these classes will be offered in that mode, and we need to keep our promises.
Thank you so much. Question here for Laura Arroyo. What improvements have been made to the residence halls assigned for isolation?
A great question. I think the first thing that we're really doing is thinking about our self-isolation spaces and the proximity of those spaces for students to get to them, and the process to make sure that that is as clean and as responsive and as easy as possible. What I will suggest for students, we've learned a lot about COVID-19. We've learned much about making sure that we can be prepared and be responsive and thoughtful from our end, but also from the student's perspective. I often think about this as the importance of keeping an overnight bag, keeping those pieces of articles and amenities that would be helpful for them during their time that they're in self-isolation, to ensure that that time is is taken care of with supports that they need, whether that be their computers, whether that be access to their phones. Of course, internet access is accessible to all of our students, but we want them to bring the materials that they need to make their spaces as comfortable as possible. And then the other thing I will say is that we're learning a lot about how long we need students to be in quarantine. And that's important, right? We're not keeping students in quarantine or in self-isolation any longer than they really need to be, so that we can then introduce them back into the community.
And Andrew, would it be okay if I added
Sure.
a point?
Go ahead.
So I love what Laura said, and also think that, one of the things that we've really looked at is the holistic health and wellness and also the experience. And we learned a lot last semester and had really good conversations. Hiring a care coordinator was key so that we have a staff member who's checking in every day and someone in isolation. Laura, I think, mentioned this as well. Those electronics, those personal items are really key, but it's also getting the personalized outreach and support. So we have mental health professionals and also peer counselors who can just check in and say, how are you? There's small things that we've done around grab and go boxes for engagement opportunities, for not feeling so isolated and lonely, because it's a very quiet space and you're being removed from the space that you're calling home. And so however we can do that, sometimes it's as simple as opening the windows and getting some fresh air. And other times it's delivering some goodies and cookies and warm items. So please do know, we've learned a lot. And like I said, the professional staff who are there to support is one of the biggest additions that we've made.
Wonderful. Another question for Laura Arroyo. This person's student is really suffering from Zoom burnout and not feeling like they're really fully realizing the CU college experience. Are there some creative ways to use the campus to bring students together safely, make them a part of the CU community? What campus buildings are open at this point, such as the library, student union, etc.?
This is such an important question. I think it really connects back to what Jennifer was sharing as well. We're hearing from students that they're feeling isolated and they're feeling burned out about this kind of virtual experience that we're needing to do for safety. What I will say is that we're really working to make sure that there are in-person opportunities as well. And we're doing those as safely as possible. So we're paying attention to the dial. We're being responsive to what we can provide and when. We have a website of activities across campus that students can engage in, and we expect to have over 500. So there's many events. The other thing I will say for our residence hall students, Residence Life is really making a commitment to provide in-person opportunities to students, knowing that they need a change of venue. They need to see people in person safely, but I think we can do that. We've learned a lot about COVID as we move into the spring. So we're very committed to that. And those in-person events will be starting as early as next week. So if your student is living in the residence halls, please make sure that they're checking in with their RA and with their community staff to know what's available to them. The other thing I will say is that sometimes it's just a change of venue. Sometimes it's not just about being on Zoom, but it's where you are on Zoom. What I'm hearing from students is that they feel really set and stuck in their spaces in their rooms. We're working, Residence Life is working very closely to determine what spaces we have in the building, what spaces we have across campus that are accessible to students, that can be a different space for them to continue some of the virtual things that they also need to do. But sometimes when we create the difference in space, that also creates a difference in emotion and feeling.
That's a great tip. Might have to try that for the Zoom work from home. Another question for Jennifer McDuffie. If a staff member is vaccinated, do they still need to participate in surveillance monitoring when returning to campus?
Yes, at this time, we are asking anyone who's vaccinated to still participate in monitoring. And there are a few reasons why. Most of that has to do with the research around vaccines, and not one of them currently is 100% effective. And so still making sure that virus is not shedding and that there's not a spreading of the viral of the virus. So I want to make sure at this stage that we can ask for everyone to continue through monitoring, testing, and then we would reassess once we've reached critical participation with vaccines. I know that there's a lot out there around, is it 50% or 70%? So it's definitely something that we're monitoring and will adapt to.
Great. Thank you. Another question for Catherine Eggert. What if a student's enrolled in an in-person class, subsequently contracts COVID or has to quarantine because of exposure? Is there a provision for that student to make up work missed during that time in an in-person class?
Yeah, so our faculty who teach in-person classes are used to teaching in-person classes and are used to dealing with students who are ill and need to miss class. So they will work with the students to give them makeup assignments or other makeup opportunities for the class. So if a student needs to be away from class because they're ill or because they're quarantined, they should immediately reach out to their instructor and explain that they can attend class, and the instructor will work with them to make sure they're able to make up their work.
Great, thank you. Another question for Laura Arroyo. My student is an off-campus freshman and would like to know if there are ways that he can have meals on campus with his friends in the dorms.
This is a great question. Not in the residence halls, but I do think there's a lot of opportunities for students to connect, be physically distant from one another, but still eat together. One of the things that our dining services staff are working on right now is a reservation system that would allow 50 students on any given hour to be eating within the residence hall or be eating in the dining hall, physically distant, but still allow them to eat together in groups, which is really wonderful and something that our students, I think, have really been requesting. For those students that don't have a meal plan, because this also is in reference to our off-campus student population, there's a number of spaces across campus that students can still utilize. I know this week our students are returning, and it has been so wonderful to see them I work in the Center for Community, and I'm seeing them be in physically distant, smaller groups, eating together, talking together, learning together. And that has just been really wonderful to see. And we want to encourage that safely.
All right. Question for Catherine Eggert here. Based on the great news of no classroom or lab spreading of the virus, is CU planning to offer more in-person classes in the fall?
Yeah, we're closely monitoring what we can expect in terms of the virus and vaccination and so on. I do want to say that one of our our faculty are eager to get back in the classroom, and so we are looking at ways to offer as many in-person classes as possible. The other thing, though, is it's important for everyone to keep in mind that as long as physical distancing requirements are in place because of COVID, our classroom space is really limited because you can only put so many people in a classroom. A lot of our small classrooms simply aren't usable for classes because there isn't room. So we're trying to balance the desire for more in-person classes with the protocols that we're under according to our state rules and guidance. And we'll do what we can to offer more of an in-person experience. But again, we can't create more classrooms where there are none. So we're limited in that fashion.
Sure. This one might be a split between Catherine and Jennifer. What statistics do you have about COVID-19 impacts to students' health and well-being? Do we have any numbers on the increase of students needing to utilize counseling? Are we tracking to correlate any impacts to mental health and well-being, academic performance, especially within that first-year student population?
Yeah, so I'll start, and I'll talk about academics, and then I'll turn things over to Jennifer to talk about health and wellness. We're working on figuring out exactly how our students have been doing. Our most recent data compares summer of 2019 2019, which was normal and live and before the coronavirus, and summer of 2020, when all our classes were remote. And interestingly, the grades that students earned were the same. There was no statistical difference between the grades earned under COVID and the pre-COVID summer. So we're working on obtaining that same data for the comparative fall semesters. And we expect to learn a lot from those data about which classes or which groups of students might be affected most by COVID in their academic performance.
Thank you, Dr. Eggert. I would add to the part of the question around the mental health. I can share a few trends, not specific data points that aren't just available, but happy to follow up if someone wants to connect. We have seen an increase in the number of students who are reaching out to CAPS, our counseling and psychiatric services, as well as our Office of Victim Assistance. We've seen in some cases the severity and acuity double. And those data points are defined by the onset of symptoms that they're experiencing, as well as we've seen quite a few of our students engage with student support and case management and feeling like, I don't know where to go, so I'll go here. So we have seen an increased utilization. I can tell you in our disability services office, we have seen the number one reason for students requesting accommodations has to do with mental health. We are also seeing a significant increase in students who are engaging in our services because of the faculty or instructors in the classroom. And I think that that is a key data point. We have worked very hard to embed clinical and non-clinical services in the colleges and schools. And we know that oftentimes our students don't know where to go or what help maybe to even ask for. And so our faculty and our instructors and our TAs have offered mental health resources to the classes. And that has been a really successful partnership and way to get students into services. And so I think the key piece there is, while some of the increases are significant, we are so thankful that they are being referred to us so that we can help support the students as best we are able.
All right. Another question for Catherine. Are professors empowered to decide on their own to switch formats of the classes if a student opts to attend remotely due to health concerns? Then will students have the same autonomy to attend remotely for in-person or synchronous classes too?
So let me address the professors first. So again, a professor who is teaching an in-person class should be teaching an in-person class. They aren't expected to offer that class simultaneously remotely. Now, an individual professor might be able to, they might be skilled in doing that and willing to do that for a student, but that's not an expectation on their part, that they will have to do that. So if a student is in that class and decides that, no, I don't want to take that class in person, I need to take it remotely, they need to speak to the professor immediately. Again, the professor isn't obliged to offer it remotely, and so that would be something that the student may need to talk to their advisor about if they just simply aren't able to take that class in person.
All right, and a similar question here for Catherine. Is it acceptable for a TA who's comfortable to offer an in-person component of a hybrid lab while the faculty member attends remotely at the same time, since variants and vaccines have not become available as expected when the course modality was chosen?
Again, we need to offer our classes in the mode that was promised at the time of students registering. So if that class was offered in a hybrid or was advertised in a hybrid mode as a lab when students registered, then by all means work to create a hybrid attendance model for your students. If it was advertised as a completely in-person lab, then offer it in person. And I just want to emphasize yet again, the virus variants are concerning in so many ways, but we are confident that if protocols are followed as they were in the fall, we are confident that viral transmission in the classroom or the lab will be minimal.
And another question for you. Are staff included in the wellness days?
Yeah, so the wellness days, it's important to emphasize, are not campus holidays. So campus is open on the wellness days. If a staff member wishes to take a vacation day on a wellness day, they should work with their supervisor on whether that's appropriate.
Great. And this will be our final question for the day. For Catherine or for Student Affairs, prospective students and parents asking for an update about CU's plans to adjust admissions requirements for SAT and ACT scores for the next round of applicants, fall 2022, and any developments on CU's campus tour experience for the future.
I'll do my best on admissions. I am not the expert on admissions, but I can say that what happens in the future with SAT and ACT is under discussion. So the next round is under discussion, and that we will make public our decision as soon as possible, because we know that as soon as the one admission cycle stops, the new one starts, and we know that people need to make decisions about their future plans.
And the only thing I would add, and it's not much, is that we do work with Kevin McLennan and his team of enrollment management to really look at when is it safe to have visitors on campus, because we know that it is critical to make a decision that's this impactful about going to college and making this community your home, and how there's a benefit to doing so after a traditional or in-person experience. So I think that there's more to come. We're really looking at the trends, the variants, the vaccines, and really hoping that we can create a safe community before committing to any visitors or others on campus.
Great,
And
thank
I'll
you.
add that we miss giving campus tours. I know that from our admissions staff. They are eager to get back to giving tours in person. So we'll do that as soon as it's safe to do so.
Yep, beautiful campus. Want to show it off when we can. Thank you all for joining us today. If you have more questions or would like to see additional information, you can do so by visiting our COVID-19 website. Again, that's colorado.edu/COVID-19. There's a chat at the bottom right-hand side of that site where you can ask questions. CU Boulder will host another update session on Tuesday, February 16th from noon to 1 p.m. Mountain Time. These updates will occur on a weekly basis throughout the spring semester, with the last webinar scheduled for Tuesday, April 27th. Also, tomorrow afternoon, please look for Chancellor Phil DeStefano's latest State of the Campus panel discussion, Coping with COVID with Wellness and Student Affairs Leaders. That'll be at colorado.edu. Boulder County Public Health is also hosting community briefings this year every Wednesday at 3:30 p.m. BCPH's agenda for those meetings moving forward is to provide updates from Boulder County Public Health leadership, updates from public health professionals on current topics such as vaccines, testing, and data, as well as updates from local partners. Lastly, the City of Boulder does once a month briefings on the third Thursday of every month. Those are from 3 to 4 p.m. Mountain Time. We'll now end today's call. Thank you all for joining, and thank you all for your questions.